This is about a 45-year-old male with non-specific symptoms of tiredness and odd mild abdominal pain on and off for many months. He underwent ultrasound and then CT abdomen, and due to the findings, MRI was also performed to confirm it. I am giving the two coronal sections of the MRI abdomen. One is T2 weighted image and the other one is stir sequence with IV contrast. Please go through the images, think about your findings, and possibly you can think about the differential diagnosis too. Are you ready? Let's go. I think many of us would have seen a moderately large left suprarenal hypointense mass which shows some heterogeneous enhancement. The first one I am talking about the T2 weighted image, and after contrast in stir sequence there is heterogeneous enhancement more in the periphery. Now I'll go to the beginners. I'll make it simple. Here in MR, usually MR T1 weighted sequence, the fluid will be hypointense and fat will be hyperintense. I mean fluid will be black and fat will be white in T1 weighted images. In T2 weighted images, both the fluid and the fat will be hyperintense. I mean both will be totally white, but the hyperintensity in the fat will be definitely less than the hyperintensity in the fluid. In general, both the fluid and fat will be looking white. Okay, now we will go to our case. I have given only the T2 weighted image as same intensity was present in both the T1 and T2 weighted images in this patient. So in our section, the hyperintensity in the huge peritoneal compartment is comparatively same as the fluid hyperintensity in the pelvic system in both the kidneys and in the intrahepatic biliary radicals. So the fluid and fat will be hyperintense. Here the fat, the peritoneal fat is so large, it looks totally white, and in comparison with the thin fluid in the pelvic system in both the kidneys and in the intrahepatic biliary radicals in the liver are looking almost the same. Both are looking the same. The fat in the peritoneal compartment and the fluid in the ISBR and in pelvic system are looking almost the same. But it is different because here it is too large. The fat is too large and the fluid is very thin. Now we'll go to the IV contrast here. Stir sequence is done to suppress the fat so that the peritoneal hyperintensity in both T1 and the T2 weighted images will be suppressed, and now they will be looking black. Now the enhancement will be very clearly identified. So that's why the stir sequence is very important here. So if the fat is not suppressed, if you are not doing stir sequence, then the contrast enhancement cannot be assessed very well. Okay. So in our case, IV contrast with stir sequence shows mild enhancement of the left suprarenal mass more in the periphery. Why I am saying this as only mild enhancement? So for the comparison, if the contrast enhancement, just for example I am giving that if the contrast enhancement is similar to that of the aorta, you can see the aorta there totally white, or the kidneys will be totally white, it indicates intense or severe enhancement. And if the enhancement, if the MRI enhancement, contrast enhancement is similar to that of the spleen, you can see the spleen there, it indicates significant enhancement. And now we'll go to the similar enhancement pattern to that of the liver. It indicates mild to moderate enhancement. You can compare the spleen and the liver. Here the liver looks mild to moderate enhancement. In our case, the enhancement of the left suprarenal mass is less than that of the liver enhancement. So that's why left adrenal gland shows only mild heterogeneous enhancement. Okay. In addition, you can compare the enhancement of the right adrenal gland. You can now confidently say that the left adrenal mass is enhancing less than that of the normal right adrenal gland. Lastly, I think everybody could have understood the pattern of left adrenal mass now. It shows no fatty component, no cystic pattern, and there is only mild heterogeneous enhancement. Now we have to go think about the differential diagnosis. The two most common ones in adrenal mass will be either adenoma or a metastasis. We definitely ruled out adenoma by the CT washout, and it was also ruled out by other MRI sequences, and hence it is not at all in our differential diagnosis. We thought about three possibilities. One, it can be a fibrous tumor like fibrous histiocytoma. The second one is chronic infective focus like a tuberculous or a fungal mass. And the third one is a malignant tumor either lymphoma or a metastatic focus. All this could not be ruled out by the imaging findings alone. Then surgery was done in the background of frozen section biopsy. A bit of left adrenal mass was sent to the pathologist, and the frozen section was negative for any malignant cells in the given section with evidence of some fibrosis. So we thought it's not metastatic focus. So we went for the left adrenalectomy was performed, and the mass was sent for complete histopathological examination. After a few days, our pathologist gave not uncommon diagnosis of a very benign neoplasm in the adrenal gland, which is not uncommon or very rare. The histopathological report was suggestive of a schwannoma with some fibrous pattern, fibrosis I'm saying. So the final diagnosis was left adrenal schwannoma. In general, MRI will show, especially the adrenal schwannoma, MRI will show low to intermediate signal intensity on T1 weighted images and also shows high signal intensity in the T2 weighted images in general, with heterogeneous announcement after IV contrast. But in this case, due to the fibrosis, the MRI intensity changes had made it difficult. Okay, so that's end of the session, and give your thoughts in the comment section. Please share this content with your colleagues and radiological residents and to those people who are connected with the content. Thanks a lot and take care. Bye bye.